Usually on Wednesdays, we have the financial clinic. Today, we have a different kind of clinic because today we will be hosting Christian Health Association of Kenya, talking about HIV, AIDS, and family planning. We've got two wonderful gentlemen in studio with me via Zoom. I've got Reverend Geoffrey Njihia. Reverend Njihia, how are you doing?
I'm very fine, sir.
Karibu sana, good to have you on the show today.
Thank you too, even for hosting us too.
Awesome. We also have Father Kalinikos Kinuthia. Father, how are you doing?
I'm very fine. I'm doing well, and thanks a lot for hosting us.
Awesome. You've got a very unique name. I've never had anyone else with that name, Kalinikos. Hiyo jina ulitoa wapi?
I think it's a Greek name. It's that I obtained during my ordination.
That's
a name
nice.
Of a saint.
Great. Karibu sana. So let's get right into this discussion. Maybe I'll begin with you, Father. Can you tell us more about CHAK and about the Christian Advocacy for Family Planning in Africa project?
Thanks a lot. And CHAK is an umbrella body, and it is abbreviation CHAK, which stands for Christian Health Association of Kenya. And it's an umbrella body for all the faith-based health facilities in the country.
Okay.
And it brings together that network of health facilities, all the hospitals and the health centers that are owned by faith-based organizations.
Mm-hmm. Do we have a lot of health centers that are being led by Christians and people of other religions?
Yes, we do. Across the country, we have a number of hospitals and also a lot of health facilities or health centers that are owned by churches.
That's good. That's good. So this issue of family planning, Reverend, is a very interesting issue. And somebody would ask, why are you religious leaders supporting family planning? Is it even biblical in the first place? Reverend, ebu tuchambue hapo.
Okay, thank you, sir. The issue of the family planning, one is a biblical aspect. We know the beginning of life is God.
Yeah.
He's the one who started life, and even the family. The first family was the Garden of Eden, and for the first time we see him trying to instruct the Adam and Eve how to bring up a family, telling them they should multiply and fill the earth and also subdue. So it's a biblical perspective, and we as religious leaders are motivated by the Word of God, and there are various verses that we can go through and we see it's part and part of our ministry.
Okay, but maybe we need to define family planning, Reverend and Father, because when I hear the word family planning, back to the day when I was young and there was a lot of campaigns about family planning, the thing that comes to mind is don't have many children. Is that what family planning is all about?
No.
Yes, define for us.
When we talk of family planning, it's not stopping giving birth. We are saying is it proper timing of children between one and the other one.
Proper
so you
space.
Plan your family. You plan your family. You have time for the mother to heal, and even for the child to grow a bit. Till you get another one. So in short form, we say is a proper timing of the family of your children between the gap between the two children.
Okay.
And probably maybe we say 2 to 3 years, it can be a good gap.
Okay. I'm just wondering, Father, do a lot of people, probably you work with people uko mashinani, would you say a good number of people have a good understanding of what family planning is?
Thank you for the question. And there are a lot of mixed reactions among people and some misconceptions on issues to do with family planning.
Yes.
And as the Reverend has just indicated, when we talk about family planning, it is not necessarily all about the methods of birth control. It is not about the issue of telling people not to have children, but how do you plan your family?
Okay.
Ensuring that those children that you give birth in your family are well taken care of, and are given quality education, and their life is they are able to get whatever or what other people are getting.
Okay.
So it is not about the issue of only dealing with the methods. And this is some of the misconceptions that are there on the ground. But if we hold hands, I think we can demystify the whole issue of family planning and embrace it as a Christian value.
Okay, okay. Why is it important, Reverend, for people to gain this understanding, and why is it important for people to plan their families?
Well, it's very important to plan your family. One, just like I said, is that when we plan our family, we shall have healthy families. We shall be able to address the basic needs to our kids and even our wives. Because if you don't plan, you may end up being frustrated in life. Okay. And also, you see, the Bible tells us in First Thessalonians 5:8, if a believer does not manage his family well, he's worse than a believer. So you see, we are called to take care good of what we have. Yeah. So it's very important, and it's a good thing that all Christians and even people, the other part of the religion, people would adhere to and plan their families for a better and a healthy nation. Okay.
You know, Father, still on this aspect of just understanding family planning, I've met people who say that you know, hata Biblia inasema watoto wanatoka kwa Mungu, na kama watoto wanatoka kwa Mungu, mimi sasa nitapanga na Mungu alikuwa na mipango yake. You know, it's like I can't plan, because after all, we've seen even people who plan and they don't get children. We've seen people who do not plan and they get children. So there are those people who have the notion that because this is life and it's the creation of life, all of this is in God's hands. Let's just leave it to him. Akitaka wakuje wanane ni sawa, ni mipango yake. And as they say, ati kila mtoto wanakujaga na sahani yake. Father, what would you tell somebody who's thinking like that?
Yes, I think it is true that number one, watoto wanatoka kwa Mungu. Well, again, the Bible in Proverbs chapter 16, it states that we as men, we do plan our lives, but it is God who establishes the course. So there is that aspect of us planning our life, and we cannot run away from this. And also, even going back to the Bible, in the account of creation, when God was creating the world, he created the world as big as it is. But when it came to create the human beings, he just created two individuals. So we can say that God planned his family. Then why would I like to say that I want to be reckless and have as many children as I can, yet I'm not even able to take care of them? So watoto wanatoka kwa Mungu, but we cannot run away from that responsibility of planning our lives.
Okay. So, Reverend, you guys are advocating for increased resources for family planning and HIV at the county level. Why are you advocating for that? What are some of the things you see on the ground that are making you to advocate for increased resources?
We are advocating for increased resources in the county levels because for quality health facilities within the rural areas, mtu wa mashinani afikiwe vizuri. Because if we don't mobilize for resources, the common mwananchi may not be able to go to the big hospitals, and the small health facilities and the health centers within the villages might be neglected in a way. And also, we also do mobilization because we also have to do what we call advocacy, telling people, informing people how can they manage their families and things that are available, and also to make sure that there are enough commodities for family planning in the local centers or local health centers, so that people may go near and be helped to get those commodities easily. And also there is another aspect of also involving the government, because the church and the government, they should work hand in hand in this issue of family planning, because the health sector is also managed also by the government.
Yes. Well, how are you doing this advocacy, Father? You know, and even as we talk about advocating for increased resources, how are you guys doing that? Or how are you doing that practically?
Thank you. We are doing this through the counties. As you know, in Kenya today, health is a devolved function.
Yes.
And so we are working closely to the county governments. Number one, lobbying for resources to be allocated in the two areas, that is family planning and HIV and AIDS. And number two, on policy formulation.
Okay.
So we are working closely with counties, and we do believe that the trajectory that we are taking, we are heading somewhere. As you know, for the past years, issues like family planning and HIV and AIDS, they have been donor funded.
Yeah.
But recently we have seen donors moving out. And so we must create we must create a platform that is self-sustaining,
yes,
with local resources, and that is why we as CHAK we are advocating for policy formulation and also resource allocation in these two areas.
You know, you've mentioned HIV and AIDS. You know, I find that nowadays HIV and AIDS is kind of like in the back shelf. There was a season where everywhere you went, I mean, people were talking about HIV and AIDS. And it seems like other things came up. You know, now we are just focused on corona. I'm just wondering, when it comes to HIV and AIDS, is it still a big issue in the country? And how are things on the ground where HIV and AIDS are concerned, Father?
Yes. It is an issue. It is still an issue. And I think we have made some progress.
Okay.
But we should not forget that the issue is still there in the ground. And there are those people that need to be taken care of. We have to add stigma. And also, we have to reduce the rate of infection.
Okay.
We have to reduce the rate of infection. The challenge that we have is that we are more forgetful. And we move from one area to the other. Right now, the whole issue that is dominating all the platform is the issue of COVID-19.
Yes.
But we still have all other underlying issues, and we must take care of them, and HIV being one of them. So we still have it as an issue in the community today. Okay.
Reverend, back in the whole issue of mashinani in the communities, you know, you're talking about better health facilities. What is the current situation on the ground in many places when you go to mashinani? Don't they have even basic, you know, health facilities that they can use? What do things look like on the ground?
Okay, we can say that our government through the county governments, they have tried to do many things in the mashinani.
Yeah.
But still there are a lot of improvement that needs to be done. And also especially to mobilize our community to know their rights and to speak for themselves. You know, many times through the county we do what we call the public participation.
Yes.
And through those such forums is where we are able to go and voice our voices and on our health centers. Actually, we can say, mashinani, they are okay. These are big guns, and we cannot blame the government. And also remembering, we are also partnering also the government and also the churches. Some churches have also health centers in the mashinani.
Yeah.
Which is also doing a very good job. So we address some mambo ni mabaya kama vile zamani, but still work should be done and done now so that we can also continue improving facilities that we have and maintain them well.
Wow, awesome. Yeah. I find it very interesting. We are talking about family planning and I'm hosting two men. In fact, both of them clergy. Because when we talk family planning, a good number of men will tell you ni mambo ya wanawake. there's that misconception that family planning hiyo ni mambo ya kina mama, hao ndio wanajua vile wanajipangaga na hii maneno yao. You know, us men, we are less concerned. So I'm just wondering, how can men support their wives where issues family planning is concerned, Reverend?
Men have a big role to play. They can support their wives even deciding the type of method they use. At times, they can also take them to the clinic as they visit and as they seek for the method to be applied. Because when a man stays away, alafu anangojea mama too, you don't know what she's going through. And you may need her when she's not ready for you. So, atusema wamama wababa wabaki peke yao. No. In fact, we are the drivers of the whole issue. You should not be seated at the back seat. You should be in the front seat.
Okay.
That's why we are here as a clergyman saying man to lead in front when it comes to the matter of family planning.
Okay.
Because it's part and parcel of us.
Great. Father, do you have anything to add to that? Wanaume wanasikiza.
I think I can add on what Reverend has just said.
Yes.
The issue to deal with the family, it is a corporate issue, such that we cannot leave it to women alone.
Yes.
We as men, we still have a responsibility and a part to play. And it is good when we make these decisions together. When these decisions are made by the couple, it is good. It is good because you see, we cannot neglect our families, because the children that are being given birth in my family, it is my responsibility as a man to take care of them.
Yeah.
And so I have a decision to make in that.
Okay. If you have any questions for my guests today, 20316 is the SMS line, and the WhatsApp number is 0786316316. Remember, we are hanging out with the Christian Health Association of Kenya, looking at HIV and AIDS and family planning. I'm hosting Reverend Geoffrey Nji here and Father Kalinikos Kinuthia. So 20316 SMS, WhatsApp 0786316316 with your questions. Let's talk about family planning and some of the common methods that families are using in the country. What do you have to say about that, Reverend? And also the fact that sometimes there's a bit of resistance where some Christians are concerned on matters using family planning methods. They see it as interfering with the work of God. What would you say to that, Reverend?
Okay. There is that misconception of when you're talking about family planning, it's like just stopping the plan of God of us bearing children. And it has been a big problem to many people.
Yeah.
But it's not that. When you talk of family planning methods, we are trying to help a couple on how to manage, how to get their kids in the proper time.
Okay.
So the methods that are used, we don't need to see them as an interference. We need to see them as a boost for them to bring up good family and to a healthy one. So that they don't just mess up with children like they be like stairs in the house. There should be some gapping.
Yes.
And that's why I am saying the methods that are there, they're not bad. And also remember, it's also through God's knowledge that God has given us all these medics. And we believe that it's a gift and it's also a service to the community. So what they bring on board, it should be acceptable. And each one of us should go and try to seek from the medical expertise what is best for a couple, because one will be good for one, and it cannot be able to be for the other couple.
Okay. Sometimes the fear, Father, is there are a lot of stories that go around, especially where family planning methods are concerned, and the side effects. You hear stories of, you will gain a lot of weight, or when you decide you eventually want to have children, it will be hard for you to get children. Your hormones will go helter-skelter, out of balance. What would you say about some of these stories that go around, Father, where family planning specific methods are concerned?
Thanks a lot for the question. And I think number one, there are a lot of misconceptions in the community, and we have to approach this thing with reality on the ground. And the reality is that most of the medicines or the drugs that we use for various diseases and infections, they do have side effects. Some of them which are very minimal, and also it depends on an individual. And so the best thing for us to do is to visit the nearest health facility so that you can get a commodity that suits you and how you are. Let us not listen to unexperienced people in the ground. Let us go to the health facilities, as we do for other cases that we do seek health intervention for.
Okay. The other issue where this discussion is concerned is the young people, the youth, the singles who are yet to be married, because truth be told, people are sexually active. Even in the church, people are sexually active. And so I'm just wondering, with this kind of a scenario, what message do you give to these young people? And I'm asking that because sometimes it seems like, are we passing the right message or the wrong message? Looking at this whole family planning aspect from the church perspective, what kind of message do we tell our young people? Reverend?
Well, as you have just said, thank you. You have just said a very important point that these young people are sexually active.
Yes.
And as Christians, we know that sex before marriage is sin. So the message that we are giving to the young people is just first to create a high self-esteem of their bodies.
Yeah.
Remember, their bodies are the temple of the Lord and should be taken care of. And also, we also trying to persuade them to remember that our God, who is our maker, is calling them to live pure lives. How they maneuver their lives. And we are struggling through mentorship programs, counseling and seminars, and even camps, trying to bring them on board and try to talk to them and even resolve some of the issues that they might be having.
Okay.
And I say it's a bit hard thing, especially now in this generation where we have a lot of sort of things, information, social media, and many things. Some encourage us, others university, and they are feeling they need to have it now.
Yeah.
But now we are telling them abstain from sex, wait till you get married. And I can say it's not a very simple fight; it's a hard fight.
Yeah.
But we as clergy and as we work through the CHAK, we advocate for abstinence for now, because their time is also coming.
Yeah.
And we believe in the biblical teachings and also counseling and mentorship programs. We are going somewhere, and we hope that there are those who hit that, and we'll go alongside, trying to help them. Those might not be able to adhere to what the messages of the word of God. But as clergymen, we are trying to bring a word of encouragement and also bring it back to their God.
Okay. Father, the dilemma sometimes when dealing with young people is, we know they're sexually active. A good number of them are sexually active, even those who are Christians. And so the dilemma, Father, becomes, okay, do we teach them about contraceptives or not? Because you have all these issues of early pregnancies, sexually transmitted diseases. We are talking about HIV and AIDS here. And sometimes you're caught in between. You don't know what to tell them, because it seems from one side that if you teach them about contraception, you're in agreement with the kind of lifestyle that they're living. But then on the other hand, if you don't teach them about it, then they're subject to all these STIs and early pregnancies, children they will not be able to take care of. So where's the balance in this? What kind of message do we give them that's balanced so that we are not overlooking any of these two possibilities?
Thank you. Yes, it is true that we do have that we do have that dilemma.
Mm-hmm.
And for us to approach this whole issue,
Yes.
number one is that information is power.
Mm-hmm.
Information is power.
Mm-hmm.
And so people should be empowered through information, be it being young people or the elderly in the community.
Yes.
They should be given that information.
Mm.
But to add on that, then we have our obligation as Christians and as religious leaders to tell them what is the plan of God.
Yeah.
How does God intend for us to live our lives? So these two must go hand in hand. We give them information, yet again we have to tell them what does God intend our life to be, which course our lives are supposed to take. So that when they are making decisions, they will make informed decisions, and they will know that they will be responsible for their actions either way.
Okay. Okay. There's a gentleman here by the name of David Mwangi. David Mwangi is getting in touch with us from Machakos County, and he says, "Good morning, 316. CHAK has been a game changer in HIV management, especially in care and treatment, retain and viral load tracking. However, what is the plan to improve on children suppression, which has been a challenge for some time now?" What would you say to that question? And then he's also saying he's a professional in cases of management, especially in children. And hata kama hakuna opportunity, I can volunteer. This is David Mwangi, Machakos County. So on issues of children suppression, he says this has been a challenge for some time now. And he's asking, what is the plan that CHAK has concerning that? Reverend, do you have anything to say to David today?
Okay. We when you talk of a family, the component is the father, mother, and the child.
Mm-hmm.
And the CHAK is trying to reach out through churches, improving familyhoods.
Mm.
So we with the children, the children, we have what we call like camps, junior and senior camps that usually hold. Mm-hmm. Despite this time of COVID, that we are not able to do them. And we do our best, try and reach out the suffering of the children through those meetings.
Mm-hmm.
And also, because we are also in the ground as church leaders, we work hand in hand even with the local authorities, like child officers and other people that are concerned with the welfare of being of children. And we can say, we are doing much, but as we know, our Kenyan community, there are things that at times are not doing well. But it's our duty and it's our goal to see that every child gets quality life, quality education, and all that needs to be done. And those who might be maybe even physically challenged or even psychologically challenged, we do also try to go through counseling and help them to see the hope of tomorrow, because all is not lost, though it may appear like so.
Okay, I think on this issue, David, is because he's talked about HIV management, especially in care and treatment and viral load tracking, and so I think he's wondering about the viral load suppression in children. He says, what's the plan to improve on the children suppression, which has been a challenge for some time now? Father, would you have any information about that?
Thank you for the question. And I know when the issue of HIV and AIDS was approached, number one on ARVs, the first commodities that arrived were mainly focused on adults. And it was a challenge to, number one, develop financing around the whole issue of taking care of children. But I know there are donors who are on the ground, and things are happening. And I think in the near future we are going to have children-friendly commodities.
Okay.
But in most of the faith-based and also in the government facilities, we do have friendly ARVs that are helping both the adults and the children.
Okay.
And so what we normally focus that, what we can emphasize is that we have to focus on taking care of the children who are infected with the HIV/AIDS, and as well as the adult. So we do have that challenge posed to us as a society, and we have to embrace it.
Okay. You know, when we talk about matters family planning, sometimes we have just customs, beliefs, a way of life that may be against matters family planning, Reverend. I'm thinking about issues of in a good number of communities in the country. When you go back to the community, it seems like the boy has more value than the girl sometimes, and you find families where Mungu anawapatia msichana wa kwanza, wa pili ni msichana, hata watatu ni msichana. Mnajaribu kutafuta kijana, hata wa nne ni msichana. So how do you tackle such issues that have got a cultural background where, this man believes lazima apate kijana, so they just keep having children and children until they get a male child? How do you handle with such kind of scenarios?
Okay, thank you for that. And it's indeed, we agree it's a very difficult situation sometimes. Into some communities, even the community I come from, they value boys than girls. And as clergy and also the ladies, we know that the man is a carrier of the seed. The woman only receives what is given by the man.
Yeah.
So we can approach that through educating our men to understand the concept of how children come to be a girl or boy, and try to bring that harmony between those. Sometimes it's hard to convince people that all children are equal.
Yeah.
Especially in the rural communities where boys are more varied than girls. But with good information, trying to talk to them and trying to bring to them the concepts of the image, the God purpose of a family like that. In God's eyes, both boy and girl, they are equal value. It's us who give one upper hand, and the other lower hand. And engaging men, talking with them, and at times it's hard. We have seen even in-laws trying to tell their sons to chase away their wives because they're not giving them
boys.
The boy child. But in real sense, is a boy who is not giving the woman the girl. So a lot of education should be done.
Yes.
To the local people, and
Very
even
true.
as we engage them, like when we are doing premarital counseling, when we are doing marriages.
Yeah.
We try to go to that concept and tell them, children are gifts from God, and God will give you, and the ability to decide a boy or girl. As much as you wish, God will have to decide, and also the man has a big role because it's his ability. And no one can say, I only have girls, I'm a weaker man.
Yeah.
I only have boys, I'm a stronger man. That one we leave it to go, and I know it's a discussion we can discuss from morning to evening.
Yes.
And we will never come to an agreement. But we are trying to persuade them and show them love both girls. And in actual sense, today their communities are changing their mind, and you can see we are all crying over a child boy, and the girl has become more better. And child boy now has somehow regretted.
Great. Father, we cannot talk about issues family planning, HIV and AIDS, and not touch on sexual and gender-based violence. So I'm sure in your advocacy for, better resources and, just creating awareness, I'm sure you face issues of sexual and gender-based violence. Question is, how do you deal with them, and what kind of message would you have for those who are listening to us today?
Thank you. It is true that we do have that challenge, and it's a problem in our society that we do have those people who look or demean other people, and maybe based on the gender. And this is an issue that is there in the community. We cannot run away from it.
Yes.
But as I had just said before, information is power. We have to empower our people, be it men or women. We have to sensitize them on their rights, so that people are able to speak out. They are able to speak out. The oppressed should be given that, because one challenge that is there is that a lot of people, and also women or children, they tend to keep quiet.
Yeah.
So we keep on emphasizing people should know their rights. And if you happen to be in that situation, speak out and seek help. We do have the police, we do have the churches. Please learn to somewhere where you can seek help. And for men who do that, or women who do that, because in recent cases we have seen women who are battering their husbands, or maybe their children.
Yes.
We keep telling people that all of us, we are created in the image and the likeness of God. And we should treat each other with a lot of dignity and with a lot of care and with a lot of respect.
Okay. Okay. As we finish, I'm just wondering, Reverend, how can communities rally together to participate in advocating for greater allocation of resources where matters HIV and AIDS and family planning are concerned? How does the community get involved in this push?
I said later in the past that one way communities can mobilize and can go for more resources is through public participation.
Okay.
And counties are calling for public participation in the county level and the ward level. We could we say, let's come as masses and talk of our needs of our local area. At times many people do ignore going to those public participation and they are their needs. Also, they should also try to talk to their local authority leaders. Nowadays we have devolution, which is a devolved unit.
Yes.
We have MCAs allowed every village and even the local authorities. So when wananchi will know their rights and they will learn to it, wasiache kuambiwa watafanyiwe nini, waseme kile ambacho wangetaka wafanyiwe, because at the end of the day we are the same people who go to those health centers.
Yes.
And we should be able to say what kind of facilities we need. Usiachie tu wakubwa watuambie na waletea hii. We should go for it.
I like
demand
that.
Because it's our right.
I like that. I like that. Gentlemen, our time is up for today, but before we finish, for that person who's wondering, how can I get in touch with the Christian Health Association of Kenya? Maybe somebody who may want more details. How can they get in touch with you guys?
Thank you. Thank you. And number one, Christian Health Association of Kenya, it is located in Westlands, around Musa Gitau Road.
Yes.
And our offices are open to anybody who may want to visit us. We do have a website, and also we do have other accounts. And I think Leverage here will give us the contacts.
Okay.
And the email maybe that one can reach us through.
Yeah. Reverend.
Yeah. Just as dear father said, is that we can be people are able to reach us, and we are open to anybody that is willing to partner with us, and especially in the matter of family planning, health issues.
Yeah.
And the contacts of our area is just as I said is Musa Gitau Road, Wayaki Way, off Wayaki Road. That's where the secretary is. And so it's if you visit, even if you go in the just a CHAK, Christian Health Association Kenya, you get a big page that will take you through and you see all the activities that we are doing.
Okay.
It's online, and is accessible to all. That
Okay.
is, and also it's also good to say that though we say it's a Christian ministry, we also partner with our.
Oh, I seem to have lost you there. Okay, gentlemen, asanteni sana, because my time is up. Reverend G here, Father Kenuthia, thank you for being a part of the show this morning, and thank you for the information you've given us on HIV, AIDS, and family planning. And keep advocating, keep doing the work you're doing. Mzidi kubarikiwa. Well, that's all the time we have for today. Thank you for being a part of the show this morning. God willing, we'll hook up again tomorrow. Have yourselves a lovely day.
For this and more of our shows, log on to www.familymediaonline.com to enjoy a wide variety of programs, from current affairs to testimonials and features, pastoral and inspirational shows, kids entertainment, and so much more. Also stream live on www.familymedia.tv.